Welcome to the Conway Clinic. My name is William Conway. We have a very special treat for you today. We are going to interview Susan, who's been one of my patients for a very long time. The purpose of this interview is to introduce you to abstinence-based treatment versus metabolic treatment for opioid use disorder. Second, we're going to track Susan's course of disease. Third, we're going to track the course of her treatment. Fourth, I want you to understand her suffering and her journey. I'd also like to have you have a very clear picture of Susan's soul as she goes through this episode in life. Understand our method. I'm using the classic bedside tradition of education used in internal medicine. It is a privilege to hear a patient discuss their illness. I have designed this interview to be entirely anonymous, so no specific identifying information about Susan will be revealed. Because of that, some of the facts of the history of present illness and the past medical history will be intentionally sketchy. The psychosocial history will not reveal anything voyeuristic or intrusive. At times, after Susan has made her discussion, I may give a teaching point. Let me introduce you to Susan.
Hey.
We're happy to have you here.
Happy to be here.
Are you frightened?
A little nervous, yeah.
This is scary, isn't it?
I didn't know how scary it was going to be, but it's very scary.
Communicating across the globe is scary, isn't it?
Uh-huh.
Susan is middle-aged. She's well-educated and intelligent. She has a profession of significance. She's the mother of 2 gifted children who are academic stars. She is a Christian who lives her faith. She has access to superior medical care. I've known Susan for many years. I've observed certain enduring qualities in her soul which define her to me. She has a quiet generosity with a lifetime of service to the disadvantaged. She has the capacity to overcome adversity for those whom she serves. Susan, you ready to begin?
Sure.
Tell us how your illness began.
A doctor had put me on opiates for pain for a medical condition I had, and that's how it all began. I was about 32 or 34, and it went on for a few years, but back to the physician, that's how it began.
When you went off your hydros, how did you feel?
Like I was gonna die. I felt my stomach cramped, my legs cramped, I was aching all over. It was just, if I didn't have that chemical in my body, I couldn't function. And I really thought literally dying would feel better than this.
You suffered tremendously?
Oh, absolutely.
Did this lead you to seek treatment?
Yes, I did seek treatment. I went to a dual diagnosis, elite center to, it was a detox program, and when I went, it was abstinence-based. And when I say that, there was no Suboxone given there. Now, some of the doctors use Sobriety to detox you, but most of them used something different that had nothing to do with a narcotic at all. But I was new to that, and I didn't know what to think or what to ask for or any of that.
What was your first day like?
Well, first of all, it took forever to get a room. And I was walking the halls, bending over, cramped, my stomach cramped. I think they gave me Bentol or something for my stomach cramps, but not for like 8 hours. I didn't get my first dose for like 8 hours, and I was struggling big time. And one of the girls was like, "Y'all are gonna have to do something. She's dying." And I literally thought I was, because I'd never been without it until then, until I sought the treatment.
Did you sleep?
No, you couldn't eat, you couldn't sleep, you would toss, you would turn, you would cry, you would do just about anything but feel good.
How long did you suffer?
I suffered for 3 or 4 days there. I stayed 9 days.
And what did they do those 9 days?
We did NA meetings. They gave me all the tools to do an abstinence-based treatment. And so that's where they left me. And after 9 days, they sent me home. And it didn't last very long.
What was their recommendation?
90 and 90 days. That means 90 meetings, NA meetings in 90 days.
As a professional who's a mother, was that a reasonable request?
Not reasonable at all, especially in a small town. No way.
As a professional from a position of significance and responsibility, is that something you'd want to do?
Go to the NA meetings? No, absolutely not. People know you everywhere. Absolutely not.
And if you'd have done that, what would have happened to your life?
I would have had no money, no job, no kids, no anything.
You would have been fired.
Oh, absolutely.
Your husband would have left.
Absolutely.
Your children would have been humiliated.
Yes.
Well, what happened then?
So I had talked to a friend of mine, and they suggested you, and I gave you a phone call, and I never looked back.
I've kept you on 24 milligrams for over 4.5 years. Your elite psychopharmacologist had you on that same dose for another 2.5 years. We have a duration of treatment of 6.5 years on Suboxone or buprenorphine. During this period of 6.5 years when you were kept on your dose of 24 milligrams, have you had any suffering?
No, none.
During this period of 6.5 years on 24 milligrams of buprenorphine daily, have you had any complications from the medicine?
No, no complications.
During this period of 6.5 years on 24 milligrams of buprenorphine, have you had any relapses?
Absolutely not.
During this period of time, have you had any cravings or compulsions?
No, sir, none.
Over this time, have you felt better as time has passed?
Yes, I think it progressively gets better and better.
What Susan shows us is the natural course of treatment for a metabolic disease. Levothyroxine often stays stable for many, many years. Buprenorphine agonist treatment also stays stable. Susan was and the dose is important. A reduction of dose arbitrarily and capriciously can lead to relapse and suffering. You've had depression. Has that resolved on your Suboxone?
Yes.
Do you believe you have a disease?
Absolutely, it's a disease. I would challenge anybody to that because Because if you have diabetes, you have to take medication, right?
Well, I'm on insulin.
Okay. That's a disease, and I feel like I'm the same way. I'm no different than you.
I agree. We all agree, don't we?
Absolutely.
Per state regulations, I ask you every month if you'd like to go off of Suboxone. When do you plan to go off Suboxone?
Never.
Okay. What messages would you like to give to our audience?
I would like them to know that there's always someone there for you. Never give up. And first you have to forgive yourself and know that there's no shame in the disease. It doesn't pick and choose because of economic status or however high or low in society you think you are. This is a disease, a metabolic disease, a chemical imbalance in which no one is exempt. If you see yourself hearing my story, please give Dr. Conway a call. He saved my life and continues to do so along with courage and doing the next right thing. And that is my philosophy about addiction, and no one knows it better than the Conway Clinic.
I did not ask you to say that, did I?
No.
Okay. Well, thank you very much. We'll ask you to talk again in another 2 or 3 years, and we'll track your course and see if you've done as well on this treatment. May peace be with you.